Most seniors don't know this, but sleeping in one specific position actually helps the heart, prevents strokes, and mitigates thrombosis. You see, we've kind of all been conditioned to believe that the second our heads hit the pillow, our bodies enter this perfectly safe, protective state of repair. But today, we're completely challenging that assumption. We're looking.
Okay, let's dive into this core question. Why do stroke risks and sudden cardiac events peak when your body is completely still? Research from the journal Circulation reveals a pretty terrifying truth. These emergencies, they don't primarily happen when we're stressed out at work or exercising or, shoveling snow. They actually peak in the early morning hours, right around sleep. So the danger isn't exertion at all. The danger is what happens mechanically to our bodies when we just lie flat and motionless for 7 or 8 hours. Our blood pressure shifts, breathing patterns completely change, and your heart? It has to keep working through all of that.
And that brings us to this incredibly powerful observation from Dr. James Cross. He's a specialist with almost 2 decades of experience treating older adults with cardiovascular disease. He says, nobody talks about gravity. It hits the nail on the head, doesn't it? When we think about heart health, we're tracking cholesterol, we're counting our steps, we're managing stress, or looking at family history. But Dr. Cross points out that once we cross that 60-year mark, gravity literally becomes this consistent, invisible enemy working against an aging cardiovascular system every single night.
So, let's look at Section 1, Gravity versus the Aging Heart, the Silent Nighttime Threat. To really grasp why gravity suddenly becomes such a big deal when we sleep, we have to look at the mechanical differences between a 35-year-old vascular system and a 65-year-old one. At 35, your veins effortlessly push blood upward from your feet straight back to your heart, totally fighting the pull of gravity. But by 65, that efficiency has quietly dropped off. The vascular system gets stiffer. And a huge reason for this comes down to your endothelium. That's the super thin inner lining of your blood vessels. Its main gig is releasing nitric oxide to keep your arteries relaxed and wide open. But as nitric oxide drops with age, arteries that used to open up effortlessly just don't anymore. They require way more effort. So, when your overall circulation naturally slows down during sleep, that arterial stiffness means blood starts pooling in your lower extremities way faster than it did back in your 30s.
And that pooling effect is exactly why this next number is absolutely crucial to understand. 300,000 to 600,000. That's the estimated number of Americans hit by deep vein thrombosis, those dangerous clots in the leg veins, every single year. And the risk shoots up for older adults. Now, most people instantly associate blood clots with long airplane flights, right? Or being stuck in a hospital bed. But the crazy reality for many seniors is that this massive risk is actually directly connected to their very own mattress and the hours they spend lying still with compromised circulation.
And this brilliantly illustrates our next point, Section 2, the flat sleeping fallacy, and why neutral is actually dangerous. We're just so used to assuming that lying completely flat is this perfect, neutral, restful state. But think about the physics for a second. During the day, gravity pulls fluid down, making it pool in your lower legs. By the evening, a lot of seniors have this excess fluid in their ankles and calves and might not even realize it. Well, when you lie flat at night, all that fluid doesn't just happily stay in your legs. It redistributes. It literally rushes up toward your chest, your airway, and the spaces around your heart. This causes nighttime breathlessness, blood pressure spikes, and totally disrupted sleep. Let's break down the hidden mechanical tax of how we typically sleep. If you're flat on your back, gravity pulls the soft tissues of your throat backward. For older adults, this frequently triggers unseen oxygen drops and sleep apnea. Every single time your oxygen drops, it kicks off a stress response, making your heart rate and blood pressure spike silently in the dark. Now, stomach sleeping? Just as bad. It directly compresses your chest cavity and squishes your diaphragm, which severely taxes the heart. And even sleeping on your right side, while a bit more nuanced, can put extra mechanical strain on the inferior vena cava, basically adding resistance to the blood that's trying to make its way back to your heart. To put all this into perspective, let's talk about Henry, a 71-year-old retired civil engineer who saw Dr. Cross. Henry was doing everything right, you guys. He monitored his blood pressure, took his meds, got his daily walks in, yet almost every night between 2 and 3 a.m., he'd wake up with his heart just pounding out of his chest, feeling this heavy density. The weird thing? His cardiac tests were totally normal. The actual culprit? Henry was a lifelong flatback sleeper. By simply changing his sleep position and angle, which we're going to cover in a sec, his terrifying 3 a.m. heart palpitations completely vanished. No magic involved, just basic cardiovascular mechanics.
But wait, it gets wilder. Beyond the fluid shifts and airway issues, lying flat triggers another really terrifying biological reaction, and it involves the vagus nerve.
This nerve runs all the way from your brainstem down to your abdomen, and it regulates your heart rate. Now, your esophagus runs right alongside it. When you sleep totally flat, especially if you've eaten recently, stomach acid can slide upward. This irritation in the esophagus actually stimulates the vagus nerve directly. The result? It triggers a sensation that mimics a full-blown heart attack. We're talking a racing heart, chest tightness, and sudden, intense anxiety.
This exact vagus nerve reaction was the nightmare Arthur, a 68-year-old patient, was living through. He kept waking up at 3 a.m. in an absolute panic, totally convinced his heart was failing. He went through 3 separate cardiac evaluations, and they found absolutely nothing structurally wrong. The real issue? Arthur was eating his biggest meal at 8 p.m. and then lying completely flat just 2 hours later. Once he shifted his eating window and started using a proper upper body incline, those phantom cardiac events were gone within a month. His heart was perfectly fine. It was his sleeping angle that was causing the crisis.
Now, what's really interesting about this is the profound difference between how we think we should elevate ourselves and what actually works. A lot of people hear elevate your head, and they just stack 2-3 pillows. But think about what that does. Stacking pillows dangerously bends your neck forward, curving your cervical spine, while leaving your chest and heart basically flat against the mattress. A wedge pillow, though, that safely elevates your entire torso, your chest, your heart, your lungs, as one continuous unit. That gradual incline is the real secret to supporting healthier nocturnal blood pressure.
Moving right along to Section 3, the left side advantage and how to work with your anatomy.
So if sleeping flat on your back, your stomach, and your right side all come with these hidden cardiovascular taxes, what's the optimal choice? Well, Dr. Cross started noticing this really consistent pattern. The patients who were quietly, steadily improving without any medication changes, they were sleeping on their left side. Take Ruth. She's a 69-year-old who literally just rearranged her bedroom furniture and started sleeping on her left side because of where the TV was. Completely by accident, she cured her morning ankle swelling and nighttime palpitations. The anatomical benefits of the left side are absolutely remarkable. First off, because the heart sits slightly left of center in your chest, lying on your left side means your heart is uncompressed by surrounding structures. Second, it actively supports your thoracic duct. That's your body's primary lymphatic drainage channel, and it empties predominantly on the left side of the chest. So you're working with your body's drainage pathways, not fighting them. And finally, clinical research actually shows this position improves autonomic nervous system activity, helping to perfectly regulate your heart rate and vascular tone while you rest.
Let's move to Section 4 and see how this builds into a complete nightly routine, the 3-step protocol.
Okay, so position alone is a game changer. But when you combine position, angle, and fluid management, you create an absolute powerhouse drug-free environment for an aging cardiovascular system. Dr. Cross developed a comprehensive routine based entirely on these mechanical principles. No new prescriptions required. It just directly addresses the mechanical vulnerabilities your heart faces every single night. Here's how it works chronologically. Step 1. Pre-sleep leg elevation. Before you even get into bed, take 10 to 15 minutes to elevate your legs above your heart. This lets gravity drain all that fluid that accumulated in your calves all day back into your central circulation while you're still awake, taking a huge load off your heart before you sleep. Step 2. Upper body wedge elevation. Grab a firm wedge pillow to create a nice 15 to 20 degree incline for your entire torso. And Step 3. Settle in for the night on your left side to perfectly optimize that nighttime circulation. The whole shebang.
I want to leave you with this incredibly empowering thought from Dr. Cross. He says, getting older does not mean the body has stopped listening. Isn't that great? So many seniors just accept nighttime exhaustion, heavy legs, and terrible sleep as this unavoidable tax of getting older. But they absolutely aren't. They are mechanical problems, and they have very solvable mechanical answers. Your body is really just responding to the physical conditions you place it in. Change those conditions, change the angle, change the position, and your body will respond by functioning better. It's that simple.
So as we wrap up this explainer, I want to leave you with a provocative question to ponder later today. How will your body feel in those first few minutes after you get into bed tonight? Really pay attention to it. Notice the heaviness, the pressure, your breathing, because you now possess the knowledge that most people never will. You know exactly how your sleeping mechanics impact your heart, and most importantly, you know exactly how to fix it. Take care of your heart tonight, and it will keep taking care of you. Thanks for learning with us today.